When you have upper right abdominal pain, is it due to the liver, gallbladder, an ulcer, or kidney problems? We will discuss how to determine the true cause of right upper abdominal pain. Of course, temporary and transient upper abdominal pain is very common and is usually triggered by gas and bloating, muscle strain after exercise or heavy lifting, coughing, or indigestion and dyspepsia, especially when there is no clear cause for the pain. However, when the pain is serious and follows a pattern, it is most commonly caused by gallbladder problems. The most common cause of upper right abdominal pain is gallbladder issues, accounting for more than 50% of cases. Gallstones can temporarily block the gallbladder duct, causing a painful process. This results in severe pain in the upper right or middle of the abdomen. Patients describe it as sudden severe pain after eating a fatty meal. The pain lasts several minutes, sometimes several hours, and can be transferred to the back or right shoulder, a phenomenon known as pain radiation. If the pain persists and doesn't go away, it can be a sign of inflammation of the gallbladder, called cholecystitis, which is accompanied by fever, vomiting, and a general worsening of the patient's health. Obesity and a high-fat diet are primary risk factors for gallstone formation. An ultrasound is the key diagnostic test for gallbladder stones and inflammation. The treatment for biliary colic includes pain relievers like ibuprofen and naproxen and dietary adjustments, while cholecystitis requires hospitalization, antibiotics, and, in many cases, surgical removal of the gallbladder to prevent further infections. The second most common cause of upper right abdominal pain is gastritis, responsible for around 20% of cases, which is the inflammation of the stomach. It causes more of a dull and gnawing-like pain. People feel full even after eating a small amount of food, a condition called early satiety. Belching, burping, and bloating are common. It is usually caused by a bacterial infection called Helicobacter pylori, sometimes following prolonged use of anti-inflammatory drugs such as aspirin or ibuprofen. Diagnosis is made by endoscopy. Treatment includes medications that reduce acid production, such as proton pump inhibitors, H2 blockers, antacids, and antibiotics against Helicobacter pylori. The third most common cause of right abdominal pain is a peptic ulcer, especially when located in the duodenum, with a probability of around 10%. Duodenal ulcer symptoms are similar to those of gastritis, but here, pain is more common 2 to 3 hours after eating and sometimes awakens the person at night. Feelings of fullness, burning sensations, fatty food intolerance, and heartburn are also common for peptic ulcers. The treatment is the same as for gastritis. Liver disease is the fourth most common cause of upper abdominal pain. Liver pain is common during acute hepatitis, which can be caused by alcohol consumption, toxins, or viruses such as hepatitis A, B, C, and E. The probability of liver-caused upper abdominal pain is around 10%. Liver inflammation pain is usually more dull because the liver itself has no pain receptors. The sensation is due to stretching of the liver's fibrous capsule, which surrounds the liver. Pain can be associated with fever and jaundice, or yellowing of the skin. While cholecystitis can have similar symptoms, its symptoms are generally more severe. Kidney disease is another cause of upper abdominal pain, with a probability of less than 5%, making it less common. Kidney stones and kidney inflammation, called pyelonephritis, are more common. Kidney stone pain is among the most severe pains a person can experience, very severe, with the patient unable to find a comfortable position where the pain will be relieved. The pain comes and goes in waves and commonly radiates to the lower abdomen and groin. Although pain in the upper right abdomen is possible, classical kidney pain is flank pain, which is located on the side and back, between the hip and ribs. Pyelonephritis, the inflammation of the kidney, is accompanied by chills and fever and more commonly results in flank pain, not upper right abdomen pain, but it is possible. Pneumonia can also cause right upper abdominal pain if it affects the right lung and pleura. The pain is sharp and stabbing and increases with breathing. Often, the person has a sense of tightness and restriction in the chest. Cough, fever, and discomfort during breathing are common characteristics of lung problems. The probability of lung and pleura causing abdominal pain is also low, less than 5%.